Good morning, everyone. Thank you for joining us today. My name is Derek Milo. I'm MAC Communications Director, and it's my privilege to welcome you to today's MAC webinar on wellness. And just to give you a little background on what we're going to be talking about today, this spring, researchers at the Wellbeing Lab went out across our state to measure the well-being of 1,500 people, representative of our population, to ask how they're doing and to delve into how people were boosting their levels of thriving and reducing their levels of struggle. And a report on well-being has been generated from all of this survey data, and you're going to be hearing about that here in just a few minutes from our speaker. And before we do bring our speaker on board here, just a couple of housekeeping notes. First, please put your questions in the chat field, and I'll share them with the speaker at the end of his presentation. And also, we do plan to post a video of this session on MAC's YouTube channel, so look for more about that in our legislative update emails that come out every Friday. And with that, I would like to introduce our speaker, Alloro, who is a social entrepreneur who creates and facilitates highly sought after evidence-based learning experiences, helping teams and entire organizations and communities dig deeper and reach higher, thereby creating a collective impact. Since 2018, he's collaborated with the Michelle McQuaid Group in creating content for the Change Lab and the Wellbeing Lab. Since 2008, he has trained and certified thousands of practitioners, companies, and communities in applied positive psychology and well-being science, including cohorts from Midland, Michigan, who he helped form a regional well-being coalition. And with that, welcome, Louis.
Hey, thank you, Derek. And hello, everybody. Good to see some familiar faces out here and some new ones. I'm just going to pass over to my colleague and yours, Bridget Granson, who's going to give us a little context for the study, how it came to be, and a little bit about the work that we've been up to in the Midland region, and just to give us a little taste. And then I'll go ahead and share some of the data. I put the report in the chat box, so you can be downloading that if you'd like right now. And then we'll have some conversation around that. So Bridget, over to you.
Thanks,
Good
Louis.
morning.
Good morning, everybody. Just a little bit about how this state of well-being report came to be. We've been doing a lot of work in Midland County on well-being since about 2018. In the past 3 years, there have been about 130 people in the community who have been trained in creating well-being and applied positive psychology, because we know that one of the most important reasons why people choose the place they want to live is because they feel like they belong there. And one of our goals is to make sure that we do everything we can to help increase that sense of belonging for our residents, and well-being is one way to do that. We also have a community vision, which certainly involves well-being, a place where everyone can thrive. Together Forward Bold, a place where everyone can thrive, is our community vision. And this goes hand in hand with trying to implement that. The Wellbeing Lab, who Louis works with, has done surveys like this in the past in countries like Australia and different places in the US, and Michigan seemed like a good place to look at next, considering some of the work that we've been doing here and trying to share that work across the state. There were several nonprofits who helped fund the survey. The United Way in Midland County was particularly interested in this data and how things like a global pandemic have impacted the ALICE, what we call the ALICE population, which stands for Asset Limited Income Constrained Employed. So in other words, some that are working poor, people who are really trying to hold down several jobs and still have a difficult time making ends meet. And as we know, many folks in those types of roles have been unemployed and have had a variety of changes in their world in the last year and a half because of COVID-19. So we love and appreciate working with Lewis and Michelle McQuaid at the Wellbeing Lab, and we are really excited to share this information and hoping that we can spread this kind of work across the state of Michigan.
Great, thank you, Bridget. One of the things that I'll just add to what Bridget said about the great work in the Midland region has been the outpouring of collaboration amongst the coalition that we formed around well-being in this area to bring it to life. So Kathy Lunsford's on the line. I'm thinking of some of the work that she's been doing to introduce these concepts in workplaces around the county. Also a project Kathy did aside from that was to bring this work to a Boy Scout troop in the county. So it's quite diverse in terms of application. How do we bring well-being to more people? And we thought a great way to do that would be to spark some more conversation around Michigan this year on the topic of well-being with this report in particular. So I'm really grateful to be here today. I'm grateful for Bridget for her collegiality and her support. And Kathy, thank you for being here. Grateful to the Midwest Collaborative for Library Services, the Michigan Health Improvement Alliance, and the Michigan Association of United Ways for sponsoring this research. We at the Wellbeing Lab use a data collection company to help us reach the folks that will go ahead and take the survey to learn about their well-being. We attempted to get a representative sample, and we almost got there. We got there by age, by gender, and by location, which you don't see on this demographic chart quite yet. Location meaning people who live in urban areas, metro areas, suburban or sub-metro areas. So we were able to reach that. We were not able to reach full racial representation, ethnic representation, but we got close. And so I just say, as I go through this, you know, with a grain of salt almost as we go through this to see, hey, what can we learn from this? What in particular is striking to you as you hear me present some of this data, or as you pop through the report that I just put into the chat box? You could download it directly to your computer. So what strikes you? How might we as an organization, a Michigan Association of Counties, show up to the challenge of creating more well-being in our communities? And what might you do personally you might be thinking of as we're going through this this data? So here we go. Without further ado, I'll just start with a definition, just so that we're all on the same page here. When we talk about well-being, we have a purposefully general definition that we use from Dr. Felicia Huppert, who says that well-being is the ability to feel good and function effectively, quite generally. Well-being involves lots of different pieces of a full life. Bridget mentioned positive psychology, which is my field. And yes, you know, well-being is about feeling positive. It's about feeling good. It's about feeling well. But well-being, we say, inspires well-doing. And that's why well-being is such an important conversation, to think about what are the components of well-being. I'll share a model with you in a little while, the one that we use. And then how do we measure it? How do we navigate it? How do we get more of it? How do we build it? How do we create more well-being? So we ask this question on the survey. One of the questions that we ask on the survey is to take what we call the state of well-being. So I'm going to ask you just right now, taken all the things together, your life as a whole, over the past month, have you felt one of these four things? Are you really struggling, would you say? Are you feeling on top of the world? Are you not feeling terrible, but just getting by? Or are you living well despite some struggles? And we ask this question because we identify and measure well-being across two dimensions: thriving and struggle. And that's what you see here on my screen right now, that you can be thriving, you can have a dimension that is about feeling well and doing well, and you can have struggle. So we have two dimensions here. People who are in the upper right-hand quadrant where they have low struggle and high thriving, we say these people are consistently thriving. People who are high in thriving may also be high in struggle. And when we say struggles, mental health struggles, physical struggles, disabilities, limiting factors, people who are struggling with their finances, people who are struggling, you could fill in the blank with what you can be struggling with. We don't ask people in this particular question what the struggles are, just how do you identify? Are you not feeling bad, just getting by? These are people in the lower right-hand quadrant here that are low in struggle and also low in thriving. People who are really struggling would be high in struggle and low in thriving. And what we have found in this particular sample that we took just a few weeks ago, y'all, just at the end of March, we went out and collected this data. And what we found in the sample that we had is about 10% of the respondents in that consistently thriving category. We found about 41.7% of the respondents in this living well despite struggle category in the upper left-hand quadrant. We talk about these folks as our resilient people who are living well despite struggle. So how do you show up to the challenges of a year like 2020, for example, where in Midland anyway, there was not just navigating of a global pandemic, but also, the floods and the dams breaking and showing up to some of those additional challenges in leadership that you all know, can strike at any time. Life happens, right? So can we live well despite some of those struggles? And the research shows we can, right? We can move people who are in that lower right-hand quadrant, the people who are not feeling bad, just getting by. We can move those people. We can give them some of the tools and strategies, skills and strengths to live well despite struggle. And that's really the opportunity in helping build what we call the confidence and motivation, the amplifiers for well-being. Do you have what you need? Do you have the mental skills, the physical skills even, to live well despite struggle? And what we know is that we're not born innately with some of these capacities. Some of them are conscious opportunities to build a skill set. And that's what we're talking about here. So we call this the state of the well-being. What I'm going to show you next is just, another way to look at the same data on the screen right now. And then I'm going to show you different ways that we had spliced this state of well-being by gender, location, etc. So first, a different way of looking at the same data I have on the chart, on the graph here, is to look at it in this pie chart. Same thing, you see that it's the same numbers, just another representation that about a little over 40% are in that living well despite struggle category. We have just about as much, 35.5% of the folks that are not feeling bad, just getting by. So just almost half of the respondents here. By gender, what we see is that more women than men have reported not feeling bad, have reported really struggling, I should say. So you could see there. I'm going to ask you not to look at the non-binary line just because we didn't have enough in the sample, enough participants who identified as non-binary to make that worth looking at right now all too deeply. But the point here being that men more than women are struggling. Men more than women here are thriving. So you could see some extremes here. By age, you see that younger people are identifying as really struggling more so than the older respondents on this particular survey. So 18 to 24, we could wonder why, right? That's an interesting question. Why might we have more young people really struggling according to this data? We could also wonder how we can help, young people at this time, struggling to, I think it's hard to be an 18-year-old in normal times, being an 18-year-old during a global pandemic when, who knows what's going on for some 18-year-olds planning on finishing up high school, maybe, transitioning into a first chapter of adult life in some ways. I would have to imagine that a lot of those plans got changed, foiled, something over the past year of the pandemic that might make it harder for young people. We see here by length of time in a particular community, folks that are newer to a community, you see here, are struggling more than folks that have been there for some time. Now, this is, we all live in communities of some sort, right? How do we show up to people who are new to a community? When you see those moving trucks, I remember being 8 years old, moving to a new community in New Jersey where I grew up. And I remember how great it was to move in that day. All the neighbors showed up with all of this food to welcome us to the neighborhood. And how I just always have such a great memory of that, being so young. A couple of years ago, I moved into this house. I live in California right now, and not one neighbor came by when I moved in that day, and so I don't know how we're showing up for our neighbors. I do know that in Midland, right, Bridget, some of the conversation in teaching more about well-being and the science behind well-being have been, how do we create more inclusive neighborhoods? What can we do to bring more positive psychology tools and approaches into where we live? And there have been folks who, for example, have designed neighbor meetups or neighbor days, block parties in their neighborhoods to convene more of the folks that live in their neighborhoods. By employment status, you could see here that people who are working have less struggle. People who are unemployed, for example, have a little bit greater struggle. People unable to work for whatever reason have a little bit more struggle. Carers on this refer to people who are caretakers, who identify either in a professional or personal capacity to be a caretaker, which we know is hard. I have a colleague who just wrote a book called The Sudden Caregiver for people. My sister was in this category not long ago when her husband was diagnosed with a cancer, where you're, suddenly become a caregiver in your life, where everything, I know for my sister anyway, changed in that moment of the diagnosis for her, and what her life and his life turned towards with those kind of diagnoses. So just, something we already know, it is hard to be a caretaker sometimes, especially when you're a caretaker at work and then going home and being a caretaker at home. So we might just consider, how do we show up for our caretakers in a way that is helpful, rejuvenating, even for those folks. I like to think of it sometimes caring for the caretaker. Here on this next slide is by location. I was mentioning we had a representative sample, those that lived in metros, suburban areas, and rural areas. I think what you find interesting on this slide is that those in rural, people who responded from rural areas, we see the greatest amount of struggle in those places and the greatest amount of thriving, which is really fascinating to see those two extremes in the same community. And so, again, just data points for conversation, which I'll open up in a little while for us to talk about. What strikes you about this? What might we do as an organization with it? What might you do personally, knowing that this is just one way of looking at this idea of well-being, which is certainly important right now. We say it's not struggle-free. Well-being is not about being well all the time. In fact, if you were to think about well-being as something that's here, you need to have ill-being, maybe we call it, or moments of struggle, harder times, in order to even know what that felt like anymore, right? So life is about a full range of human emotions and experiences. And I just say that because as a reminder, right, that even though we are talking about positive psychology in some ways, it's not about being all positive. It's about a full range of human emotions, experiences. So we were curious about people's struggles on this survey. We asked people, what's your biggest cause of struggle? We found what you see here, that mental health and physical health highest on the respondents here. We found, Bridget mentioned the Alice population. We dug a little bit deeper into Alice. We found that those were reversed, that physical health was reported as a greater challenge than mental health, both being high for the Alice population, but those figures, those statistics were reversed, where physical health was higher than mental health. And we might wonder why that is. People who are running from job to job, for example, asset limited, income employed, people who are in that Alice population, how might we help them with physical health challenges, certainly mental health challenges. May is Mental Health Awareness Month, which is why it's great that we're having this conversation right now. How do we show up for people who are reporting mental health as a challenge in a way that is supportive, strengths-based, even helping people learn to live well despite those struggles, right? And that's why we talk about it that way, to normalize struggle, normalize, hey, you might have some mental health challenges this year. This has been a doozy of a time for us all in our lives. So of course, it's going to present challenges. And so to talk yourself out of it, or to say, buck up, Ron, just do it, just get, do the best you can. Yeah, you can talk to yourself that way, or you can have a community of supportive people, resources around you to help you to really learn about resilience, to learn some cognitive, behavioral, even physical practices to calm our nervous systems, to downregulate our stress responses, and to struggle well. We say a lot, right, Bridget, in the work in Midland. It's how do we help people learn to struggle well? Something else I would just mention here is we're asking, who do you reach out to when you're struggling? That's what's next on the slide here. 43.5% of the respondents, or 48.2%, talks about someone at home as the first person they reach out to when they're struggling. And so, seeing this made me actually think about, the people in my home and to what extent I really know about what's going on in their lives, all of it. And, I'm a pretty connected human being. I do this work. I'm talking about it with you right now. What an honor. and I'm human, right? So it made me just kind of be more curious as to what's going on with the people closest to me. If people are reporting that home is their first place to go when talking about struggles, we found that if it not home, do you talk about your struggles at work? And you see here people not really speaking so much about their struggles at work. We spend a lot of time at work. And I was reading something actually a couple months ago that said, if we're not using our check-ins during our work meetings to really dig a little bit deeper as to what's going on with people, then we're missing a huge opportunity to normalize struggle. And sometimes it takes a vulnerability to share a struggle. It does take courage and vulnerability to do that. As leaders, I would encourage you to do more of that yourselves, to give people permission to do that as well. Where we can open up at work, where we spend a lot of our time, to say, hey, look, not everything is good right now. Actually, when people ask me, Lewis, how are you? I say, my answer is mostly good. I'm mostly good. That doesn't mean that I don't have challenges. I have plenty of challenges. And depending on the context, right, I'll open up and share what some of those challenges are. I just invite you to do the same thing, right? You're not great all the time. Nobody is. But just as leaders, can we make it more normalized to talk about struggle? Because it gives people permission to be honest and forthcoming with what's going on. Here we asked about loneliness, levels of loneliness. We found, this is what we found. We found most of the respondents, about 60%, feeling somewhat lonely. We have about 16.5% of the respondents feeling very lonely. Okay, loneliness is, we say in our work, a mismatch between the connections you crave and the connections you have. A mismatch. You could have all of the people around you in the world. You could have all of the friends, quote unquote, all of the followers, all of the people in your social network. You could have a lot of folks and still be lonely. Lonely is a subjective experience. In some studies, they show loneliness lights up the region of the brain that is also associated with physical pain. That is, it hurts to be lonely. And so Bridget was mentioning this at the start, talking about creating a community where everyone belongs, a vision that we have in the Midland area Wellbeing Coalition. And so how do we do that? How do we bring more people into a space of belonging? When we ask people where they felt like they most belonged, 33% said at home, 8% said at work. Only 8% of the respondents said they belonged at work. Again, another opportunity to think about, how are we building community in our workplaces? Marlene says, mental health is an issue to watch as the Michigan legislature is trying to take mental health away from the county administration and put it in the hands of hedge funds. Okay, thank you. Marlene, you want to say anything else about that?
Sure, thank you. I don't know which hedge funds. I'm just guessing that's where it's headed, because they're trying to privatize mental health, it seems. And there are some bills in the legislature. I don't know what their status is, but when I saw that mental health number in your slides, it just jumped into my mind again that this is a big concern. And especially, I'm in a rural area, so people don't have many choices for mental health help. And what the county is administering is very important.
Mm-hmm. Yeah.
So thank you for all of this. I find this really interesting and also concerning about the younger people.
Yeah. it's just a really good opportunity. I think those younger people are such prime age for interventions too, Marlene, as they're navigating that transition from adolescence really to adulthood. And you know, one of my mentors always says, you know, what do we want most for our children? And answers usually have to do with good relationships and meaningful work and a fulfilling life, etc. And then he'll ask, well, what do we teach in schools? Are we teaching people how to do these things, how to acquire and build good relationships, for example? And that's really what we're up to in teaching about positive psychology. I'll get there in a sec. This next, how does our well-being impact our income? So our outcomes. So of course, we're interested in satisfaction has traditionally been a measure, an outcome kind of measure in organizations in terms of satisfaction with work, engagement with work, innovation in work. We were doing in this particular survey something a little bit broader, looking at the community. So we were asking people about their satisfaction with life, which is also a really validated item that actually one of my mentors, Ed Diener, who just passed away this week, who has had, I think, you know, 500,000 citations of his work in the literature on satisfaction with life, for example. So we're looking here. What you see here on this slide is a stepladder effect, we call it. And that is people who are living well despite struggle and people who are consistently thriving are both, in both of those quadrants, you see similar statistics. That is, you can be either reporting as consistently thriving or living well despite some struggles and have very similar levels of satisfaction, for example, so similar outcomes. So again, you don't have to be all well all the time, right? That you can be, that you can live well despite struggles, again, requiring that we know how to do it, because James Prochaska, a behavior scientist, says that there are 3 common derailers that puts the brakes on people creating change, positive changes in their lives. They are people don't want to, they don't know how to, or they don't think they can. They don't believe that they can. Okay, so because we know that there are these derailers, we wonder, well, what then amplifies people's ability to create change, for example? So ability becomes one of the things we look for, your capacity, your knowledge to create positive changes, to care for your well-being. And we see in well-being, we ask the same thing about motivation, people's commitment to this work, and psychological safety. We ask people's ability to, or people's, you know, how safe is it in your world, in your life, to talk about well-being, to talk about struggle. These numbers here are all pretty healthy, we found in the Michigan respondents. Now, can they be higher? Of course. Can we have more psychological safety? Of course. Why do we want to do that? You know, it's been shown psychological safety as a predictor of successful teams, for example. The Google Project Aristotle study was curious about what makes their most successful teams at Google. They found psychological safety the #1 predictor of their most successful teams. Psychological safety is what I was mentioning earlier in terms of it being safe to bring all of me here. I can bring the hard things that are going on in my life and the easy things, and I can share with you all of it in a safe space. That's what psychological safety is. So we're curious, you know, what are the levels of ability, motivation, and psychological safety? We call them the amplifiers of well-being, which is why they're underlined here, AMP. What role do amplifiers play? Again, the same step ladder effect, that people who are living well despite struggle and people who are consistently thriving have very similar levels of these amplifiers, that you can still have struggles in your life and still have ability, motivation, and psychological safety. People who are really struggling, I mean, we see, a real significant difference here, right? Between people who are really struggling and then people in the blue, the light blue and the green categories. Next, I'm going to talk about emotions for a few minutes because emotions here, Susan David talks about emotions as directives, as data, I'm sorry, rather than directives, meaning, if life is about a full range of human emotions, what is my emotional intelligence like to work to get more of the joy and less of the pain, not to get rid of the pain all completely. And so we use here some very validated items from the OECD that taken together, these 4 items. To what extent in the past days have you felt worried, depressed, happy, and satisfied? Those 4 items then get combined into what we're calling a well-being index here. Okay, and according to the OECD, again, these items are used on the World Value Survey. Gallup uses these on their surveys. But you find that in general, Americans and Michiganders are more satisfied with their lives than the OECD average. So in the United States, the average is about 6.9 on that satisfaction measure here, on the purple. The OECD average is about 6. I'm sorry. So the life satisfaction, yeah. So here, 7.2 in Michigan. We have in the United States on average, it's about 6.9. In places like Denmark, Finland, Iceland, the best places to live, consistently at the top of the list of the best places to live, you see about 7.5. And so Michiganders aren't doing so badly here. Again, I'll just caveat that by saying of those that we sampled, because I'm sure we'll find folks that aren't as satisfied. Just a couple more slides and then I'll open it up for some conversation and questions. We use this model to talk about well-being a bit more concretely, that people who have these factors, we call them the Perma Factors, have a better ways of thinking about their well-being and contributing to it. So positive emotion, of course, important to know something about. There's really great research on what positive emotion does for our brains, in particular. Even all of our bodily systems, there's research that shows that people higher in positive emotion are more resilient to sickness, for example, to influenza or virus in some studies. So that's why positive emotion is important. It also helps us be creative in solving problems, and certainly communities, counties are up against lots of problems right now. So just using this as a strategy for innovation. How do we show up to some of those? Do we use our strengths? Are we engaged? Is it something that I feel committed to on a level of engagement? How are the relationships? How high quality of the connections are there? And are we contributing to building more high quality connections? There's a lot of there's a lot of work to do. I get that. There's a lot of tasks, right? We talk in times about making the relational as important as the rational, so that we can show up again to those tasks differently. Meaning, accomplishment, and health. Health are those things about moving and sleeping and eating well. Some of those things probably our grandmothers and parents tried to instill in us, I hope. But again, things that people need to be reminded of. So when we look at the Perma Factors on the survey, this is what we find here, that across the state of Michigan, people are rating relationships higher than any of the other perma pillars. This to me makes sense, right? Given the past year of maybe working from home, reconnecting at home, maybe I know that I've participated in some Zoom meetings of friends that I haven't spoken with in years over the past year. So perhaps that's why this is the first time we've gone out to the state of Michigan to collect this data. It'll be interesting to do it again 6 months from now to see what changes. You notice on here, health and accomplishment being the lower of the pillars that we've measured here. Again, for the Alice population, health becomes even lower as the self-reports come in terms of how people are doing. Something just to keep in mind. Once again, we have this step ladder effect here, that people who are really struggling, you could see what are they really struggling with. On here you see positive emotions being the lowest, and again, that indicator of health. So even amidst the really struggling, how do we help people get a daily dose of positive emotions that can have buffering effects even to some of the challenges that we're up against? I'm just noticing the time, and I want to give us some opportunity for questions and to converse about this. So I'm almost finished. We asked about PERMA at the me, we, and us levels, we call it. Me being on an individual level, how is your positive emotion, for example. And then we asked about people's families, their work groups, if they were working, and the community. And, when you ask people about, say, for example, the health of their community, you see here at the last bar on the whole chart here is the lowest. People's self-reported ratings of the levels of health within their communities. So how might we be able to work with that? That's all I'm going to share with you right now. And I would like for us to just think for a few minutes, what has struck you from these findings, and how might we show up to some of the challenges that we're up against here. So we have about 20 minutes, Derek, to field some questions and have some conversation, and just open it up. Yeah.
Yeah, we have about 20 minutes left. I'm looking in the chat field. I don't see any specific questions, but if you do have a question, feel free to unmute yourself and just ask it directly.
Or comments.
Conversation.
Yeah. What strikes you as you even pop through the report PDF that I had in the chat?
I would say I was really struck. I was mentioning this to Bridget about the number of people reporting significant loneliness.
Mm-hmm.
Do you have any context historically to that figure? Is that a distorted figure due to the pandemic, or is it just a growing trend in our culture generally?
It's a growing trend, unfortunately, in the culture generally. I think that trend increased over the past year for some people, but it had been a trend before the pandemic. Derek, when you think of our society, our culture, even our kinds of addictions to our phones and our social media, people can be appearing to connect without really having the experience of full connection. And I know that I age myself when I say this even, but looking at even some young people whose lives are only lived on their devices, right? That they, that what might be missed. I know, fortunately, I have a dog that gives me an opportunity to get out, go for walks. And even in those moments, those micro moments of being at the dog park or passing someone on the street can be so good for us, just to say, hey, good morning, Tamara, or hey, what's your name? And just have a micro moment of connection, even, with the barista at the coffee shop, or with someone at the grocery store. So unfortunately, I think the masks kind of prevent us from seeing all of those facial expressions, that those nonverbal cues. There are hundreds of them that come from our faces, from our mouths, things that we're missing with the masks on. So just with that awareness, know that we might have to work just a little bit harder to get some of those connections where we can.
Lewis, I'd like to weigh in on that a little bit. So I was telling Derek that my son graduated from high school 2 years ago for his senior advanced English project. He actually did a presentation and research on loneliness as an epidemic in this country, which that was his topic. And some of the information that he found during his research to me was very alarming. So there's, I think it was Cigna Health did a study, and of course it's all self-reporting, but the largest group of self-reporting people who were suffering from loneliness was this younger generation from ages 16 to like 25. And Lewis alluded to our electronics and social media that make it easy to meet people without actually being with people physically. But I think one of the things that my son found in his research is there's a huge difference between loneliness and social isolations. So you can be socially isolated but not feel lonely, right? And you can be in a room full of 20 people, whatever our maximum capacity is right now, and still feel lonely. So that sense of belonging is really important to he gave the kids in his class some ideas about how to, help prevent loneliness, doing check-ins with people. There were a lot of different strategies, but I think the thing that he found the most striking is something I put in the chat a little bit ago, and that is researchers have found, and I also put a link to this website, that loneliness can be more adverse to your health than smoking 15 cigarettes a day. And there's a lot of reasons why, right? So I think that number is startling if you don't have any information on it, but I also think that Lewis is 100% accurate, that statistic has probably gotten worse in the last 18 months.
Okay. I do have a question in the chat here, so I'll pose it for everyone's consideration. A common theme is we need people and relationships. How can we as leaders encourage people to connect with one another, particularly given our significant divisions over politics, guns, sexual orientation, etc.?
Civil discourse. Which I'll just pop in. One of the outcomes in Midland has been some really good work with the University of Pennsylvania's Positive Psychology Center over the past few years, and some service learning projects with students in the Masters of Applied Positive Psychology, where I studied. And one of the projects from this past year has been a development of civility training, applying well-being science to, how do we help people learn to be more civil? Again, a capacity issue, I think, or a capability issue in some ways. And so not just expecting people, oh, just go do it, but here's some process around how we can do this better across differences, for example, has been really successful. And the Rotary, actually, the Midland Rotary has picked that up as a project now out of Rotary. So the Midland Area Wellbeing Coalition has been formed. I think we formed that in 18, Bridget, and it's now the vehicle for coordinating some of these regional wide initiatives that are helping all sorts of ways. The civility training is just one of those ways. Go ahead, Vaughn.
This is Vaughn Begic, yeah. So some of us being politicians, civility in politics has been a struggle. It seems to be the negative campaigning that comes out, and they say that's what wins elections is negative campaigning, which is not a good thing either. So I think we could practice a little bit more. I think at the county level we're pretty good, but once you get to the state and federal level, the civility level seems to drop off. One other point is, when I was younger, sports were big. Everybody went out and played. You had a team you played on. Here in Bay City, we have like rec leagues and stuff. They used to have like 50 basketball teams. They have 15 basketball teams. Softball teams are down. So the team sports thing, which is sort of a bonding thing, you're not lonely. You're on a team. You have a common goal. So I don't see that as much. People are more isolated with their iPads and whatever else, and not getting out and participating in sports. So I know Midland's got a strong sports program out there. In fact, I'm playing 60 and over softball in Midland.
Nice.
It's a little painful, but I'm trying.
What's that line?
We will
No pain,
welcome
no
you
gain.
with We'll welcome you with open arms, Vaughn.
Yes, although we got rained on last week.
Yeah, I love that, Vaughn. It's kind of, it's about being flexible and agile too, right? It's raining. Okay, we'll pivot. We'll try something else next time, or, I think that's great and really inspiring to get out there. I think with some reminders, people know that one of the outcomes in Midland for loneliness has been through the hospital system, which one of the projects that came out of our coalition has been changing the process at Mid-Michigan Health to assess for social determinants of health now as you go to visit your doctor. So a couple of participants in our positive psychology certification in that region, Dr. Kathy Dollard, one of them, helped change the process for the hospital system. So now that if someone identifies as lonely, there's a process that gets triggered through 211 that connects them with resources in the community. So someone might be called, Vaughn, and told, hey, did you know there's a group of people meeting for softball every weekend over at da-da-da-da-da-da-da-da, and maybe even call Vaughn and learn more about it. Or, how do we connect people with other people had been that conversation.
My other career is physician assistant. So I'm in the medical field, family practice. So they've done many studies, and a lot of the health problems are related to depression and mental health issues. So, we're starting to screen more for mental health issues, doing more of a social determinants, what sort of support system they have, they live alone, what they need to get their medication, things like that. So it's really the whole patient picture versus just concentrating on the health part of it only.
Whole person. Love that.
Okay, well, we're coming up toward the end of our hour here. If anybody has any other questions, I don't see anything in the chat, but of course, feel free to unmute yourself. If you do have a question, we're going to take probably just about one or maybe two more at most. And then we're going to cycle out of the hour. So feel free to get in your last questions. Okay, apparently everybody is going to end on that note. So I would say on behalf of Mac, thank you for joining us today. And as I did mention, we will be putting up a copy of the video recording to our YouTube channel once we get the video properly edited from my ham-handed skills at launching the Zoom earlier today. So again, thank you for joining us. Louis, Bridget, thank you for arranging to set this up. And I wish you a healthy and happy day.
Can I just add one more thing before everyone hops off? Let me just say, I popped into the chat my email address, also the URL for you if you're interested in taking the survey yourself, just to see what the items are and what. There's a really rich report that comes with your results that are customized for you in terms of well-being strategies then that are offered to you. You could build a well-being plan from using this tool. So to take a look at that link and contact me if you're interested in just having a conversation about how you might use this survey in your community, in your region, the way that we're using it in Midland. The survey itself, as I was just saying, is an intervention. So if we can get the conversation about well-being into more places, that's really our intention in sparking more conversations about well-being around the state of Michigan this year. So if you're a bridge to that, or if you want to have a conversation about that, please reach out. So many reasons I have on the screen right now to invest in well-being or to make well-being a priority. And so if this is something that sparks you, then reach out to me or Bridget and we can continue the conversation. So thank you, Mac, and thank you, Bridget, and thanks Kathy Lunsford for being here too, one of our Wellbeing Coalition members in Midland. And I'll stick around for anybody that wants to ask any additional questions, but thank you for taking time to be here this morning.
All right, great.
Thank you,
Thank you, everyone. Have a good day.